Good morning and welcome to Veterans Call, a show for and about veterans. My name is Shannon Nisbet and I'm Director of Veterans Services for the town of Franklin. I'm very excited to introduce our special guest today, David Hencke, who is the Veteran and Community Outreach Coordinator for the VA Boston Healthcare System. Welcome, David.
Thank you, Shannon. It's great to be here and great to be down this part of the state and be outside of Boston. but really joy to be here.
Oh, thank you so much. I have a lot of questions for you today because there's such a wealth of information I want everyone to know about VA healthcare. But I'm going to start with a basic question. Why use VA healthcare?
Well, it's like a lot of things like warfare. It's very simple, but it's complicated as well. But I'll say up front, there are two or three things that really catch most veterans' attention. And one is it's just exceptionally good health care. It's tremendously high quality. We have the same physicians that are practicing and giving care in a lot of the local hospitals. One of my physicians, the same guy I used to pay a lot of money to go see at a hospital in town, and now I go to the VA, I got the same guy, I get the same treatment for almost $0. And so you get really quality care, which also leads into that cost savings factor because you're not paying all this money. It's not a money making enterprise. So it's tremendous cost savings.
Oh, that's so important. I know for so many of the veterans that come to our office and people in the community, that's a very big consideration.
Yeah, if you ask my wife, she'll tell you again and again, yeah, he's doing great at VA. That's a good reason to go there too.
Oh yeah, absolutely. And actually, tell us a little bit more about your role at the VA.
So I did 30 years Army, and that's Guard and full-time service. And as I was retiring, I jumped right into this wonderful position at the VA. I'll say it jumped into a wonderful organization. The VA is just a tremendous place. And I was talking to a veteran the other day who we got him enrolled here like a year or two ago, and just happened to reconnect with him. He said, "Hey, yeah, I've been going to the VA ever since you got me enrolled here, and I got to tell you, that place is awesome. I feel so good when I walk in there." And that really is a big part of it. It's because, people are there not just to do a government job. They're there on a mission. And, 90% of the folks working at the VA, they're either prior service military themselves, they're married to a military service member, prior service, or they've got some friend, family member, whatever. But the point is that they get it. They understand that the veterans are unique, and there's this very strong appreciation for folks that have served. So when you walk into the VA, that's just this great connection. So when I came in as a prior service person myself, I just found this great environment, found a lot of the veterans, people I'd served with, and and I realized this is really an incredible place. It's not just a hospital. You walk in and it's just a power source of strength and resilience. So it's a great place to be, and it just so happened that as I was coming off of duty, that they had created an outreach position because so many veterans just weren't taking advantage of the VA care system.
Oh, so I'm glad they created that position because we're hoping to change that. And I will say I have gotten feedback from the veterans I work with who use the system,
Yep.
that how veteran focused it is. And like you said, it's not just about healthcare, it's part of a community.
Yeah,
So,
and I tell veterans, if you look at it this way, because there is this mindset that, well, I have great health care. And in Massachusetts and most areas, folks are pretty well employed. There are a lot of, they have insurance programs. It's all great. But VA care is something that you've earned by serving. So you can't pay for it. You can't go out and buy it. You have to have basically earned it. And if you qualify to use it, it's like hitting the jackpot. And young guys and gals getting out of service, we'll talk to them like, "Oh yeah, I'm getting this done." I said, "Yeah, but look at me, look me in the eyes here. Realize you've nailed something that so many Americans are falling short on, and that's just high quality health care at little or no cost." Like, who gets that? And American veterans. We are really, really blessed in a unique position with all these benefits. And there's so many vets that don't grasp it. I need to use this. This is phenomenal.
Oh, excellent point. Very well said. Um, Speaking of eligibility, just to get into the weeds a little bit, but in general, who is eligible for VA healthcare? Is it all veterans, or are there some criteria?
I wish it was. I wish it was, but our Congress has a way of orchestrating things too, and providing these guidelines. So essentially, you had to serve active duty, and that is either regular Army, Navy, Air Force, Marine Corps, Coast Guard, whatever, regular active duty for approximately 2 years. Now, if you went in before 1980, 1 day of active duty actually qualifies. But after 1980, it's roughly a 2-year service obligation, and have that honorable or under honorable discharge condition. That's the primary entry. These are the 2 gates to get through. The next step, I'll say, unfortunately, talking about the congressional limits, is income. So there is an income limit, and that is the most heartbreaking part of this role and this mission, is telling veterans, gee, guess what? You make too much money. And you know what? I was one of them. 30 years of service, I got out and they said, you know what? You make too much money. You can't use the VA. I said, when did my service have anything to do with the money I make, And they said, yeah, well, this is a congressional thing. There's a limit on what you can make. And I said, okay, what's the limit? And so roughly, around the Boston area and extending out here might be a little bit cheaper, but they graduate it based on the geographic area. But it's called the geographic means test. So for an individual veteran, it's gotten a lot better now. But just a few years ago, it was terrible. But they have really jumped it up in the last several years. And so basically, it's about if you make $100,000 or less as a single veteran, you're in the door.
Okay.
So that's it. But now they also count your household income. So they count your spouses too if you're married. And that limit, unfortunately, it's only about 115.
Okay.
So there are a lot of veterans, unfortunately, not a lot, but a number that do get knocked out in this area because they're making decent income. They're married, and between there and their spouse, they're making it. So it's over 115,000 as a household. Then we have to consider all these special exceptions.
Oh, yes. This is key.
Right. Exactly. Yes. And this is how Dave Hencke got into the VA. So because as I spoke to the people at the VA, I said, well, are you kidding me? And they're like, no, it's not us. It's Congress. I said, so I can't use VA care? I said, I'll pay for it. And they said, no, can't pay for it. It's an earned benefit. You either qualify or you don't. It's like, well, that stinks, because I was looking forward to coming right out of great military health care, and I wanted to jump into, start using the VA. I'd met all these great people, and as we were mobilizing, deploying troops, and the VA was always right there, all the staff from the veterans benefit side of the house. I'm over here at the healthcare side, but they were all right there. So I knew I liked the VA and I really wanted to use it. Well, somebody said, well, look, there are other ways to qualify for VA care where your income doesn't matter. Number one, did you deploy to Vietnam? Well, no, not old enough for that. But it turns out for any of these major conflicts, the Gulf War, and most recently Iraq, Afghanistan, post 9/11 vets, if you deployed in any of these zones, you automatically get to walk in the door and go into the VA. And do you have any idea why that is, or
because
what's the
of
common between
toxin exposure?
Yeah, you nailed
yes,
it. Yeah, toxic exposures, right? So Agent Orange, Vietnam, the oil well fires in the Gulf War, Gulf War I, and then most recently all the burn pit incidents. And the great thing is the government did the right thing. They went in and said, and it just tried to broaden the opening as much as they could, just saying, look, it doesn't matter if you're sick or not. You don't have to have a sickness or an illness from your service. But if you served in those areas, you get to walk in the door of the USVA. But the other big one is this: service-connected disability. So let me talk about that real quickly.
Take your time.
So I'll orient you to the VA for folks that don't know. So there's basically four big blocks of the VA. There's the Veterans Benefits Administration, the VBA, and they have regional offices, one in Boston, that's the JFK building, and there's one downtown in Providence at the federal building there. Those are the folks that give money out to veterans. So, what are we talking about? Like GI Bill, home loans, stuff like that, right? So any money flowing from the government to veterans is coming through the VBA. And the other big one there, of course, is service-connected disability. It's like, what's a service-connected disability? Well, that's if anything happened to you while you were in service, some kind of injury. That could be mental, emotional, spiritual, physical, of course, any of these things. If you've had some kind of an injury in service, doesn't matter how many years later, but if you're still feeling the effects of that, it's still impacting your life some way negatively, and it's connected to service, then that is a service-connected disability. And so that's, you can apply for that through the VBA. If they grant that service-connected disability, you automatically are entered in, or eligible to use the next big block there, which is VA healthcare, the VHA where I serve, and that's 1,700 or 1,500 clinics across the country, 170 plus major medical centers, every corner of the United States, completely accessible everywhere. So that's veterans healthcare.
Yes. So that is great to know that there are exceptions to those other rules.
Yeah.
And part of my job is I'm an accredited VSO, and I help people apply for VA disability. Sometimes the main goal is actually not so much the money, but to get into VA healthcare.
Yes.
I want to say to the audience, most veterans, especially those who served before 2000 or the 90s, usually have some kind of hearing loss or tinnitus. So if you think you might have a service-connected disability, please come see me. I also want to point out, as to what you were saying, for those who served in the National Guard and reserves, that they can apply for VA disability even if they don't have that qualifying active duty time. So that is a way for those service members to gain access to VA healthcare.
Yeah, because going to basic training and AIT, advanced individual training, et cetera, unfortunately does not qualify for VA care. You have to have served active duty or been called mobilized, federally mobilized. And of course, we've had tens and hundreds of thousands that have been qualified since 9/11. We've got groups, Massachusetts Army Guard soldiers right now that are deployed in the Horn of Africa. They'll be coming home here in a few months, all going to be qualified to use VA by and large, so because of that deployment. So for folks, as you were mentioning, that does open the door somewhat. And getting that service-connected disability is great because you do get, I think it's roughly $180 for every 10 percentage points now. So it goes 10, 20, 30 or whatever usually. But like you said, that's not the big win. If you which was for me, same way. So that's what I did in short. To get into to tie up that story, somebody said, well, do you have a service-connected disability? I said, no, I'm not disabled. I don't want to be that disabled guy. No, look, knucklehead, look here, look me in the eye.
Right.
If you had anything to happen and it's still bugging you, that's a connection, and it's going to open the door to use the VA healthcare. I was like, oh, okay. So I got this and that, so I put in, in the infantry, things happen. And sure enough, a few months later, bam, VBA sent me a notification. You have been awarded, 10% disability for this and that, and so on and so forth. So I immediately called the VA hospital that day. I said, hey, you guys said that I couldn't use care before, I was over income. So what's the deal now? So they're clicking in the system. They're like, oh, congratulations. They see you got 10%, when would you like to come in for your first appointment? And that's how it happened. It was that quick. And you know what? It was 10 days later. I had my first appointment, a primary care doc at the VA. It had taken me several months to go to one of the best hospitals in North America even, but it took me months to get a primary care, and the VA had it within a matter of a couple of weeks. So, and to wrap that part up, I live 3 blocks from this great hospital, right? I have never stepped foot there again for years now since I started using VA care. Once I walked in the door of the VA, I've never even thought about going back there because I've got everything I need at the VA. I still have, because you can still keep your primary care. You don't have to give up other care.
Oh, thank you for making that point.
Right.
Yes,
yeah,
absolutely. And so not only can you, keep your other doctors, but you might even be able to use community care through the VA, but we'll get to that a little bit later.
Okay.
So I want to talk a little bit, continuing along that thread, what happens after you apply and you find out you're eligible and you're enrolled? What are the next steps after that?
Yeah, it's funny. We have a number of veterans that, they get enrolled and, you got to fill out the form and do this. It's not a huge amount of work. it takes you 15, 20 minutes to develop the eligibility form. And if you qualify, holy smokes. And again, back to Guard and Reserve, there are a number of guardsmen and reservists. And these are people that are twice a citizen because they're going out and they're spending, 2 to 3 weeks in the summer, 3 days out of the month, going to drill, giving all this extra time and holding down a civilian career. And they got to be a military professional and a civilian professional. These are the best of the best, I think, our Guard and Reserves. But but they get cut out of VA unless you got mobilized or this and that, or unless you've had that service-connected disability. So there are a number of veterans, or a number of guardsmen and reservists recently that I've seen, exposed to, loud noises, explosions, whatever, during their training time or annual training, and you got hurt, falling off the back of the deuce a half, trying to get out, and now you've got this, knee or ankle. But that's a service-connected disability, so we see a lot of people qualify for that.
Absolutely. So I want to talk a little bit about the role of the primary care team.
Right.
So someone, they get enrolled and they have to get another phone call to set up their primary care.
Yeah.
And why is that important?
Okay, so to go back on track here.
No, not at all.
So as we're talking about your experience at the VA, so yeah, you gotta take the step to get it done and get enrolled. And it's funny because you and I were talking earlier about so many veterans. We have a whole list of literally thousands of veterans that actually take that step. They get enrolled, but they never step into it. Never use their the health care that they have, their options that they have. And the only thing I can think is sometimes it's like going into the military. Before you got into the military, you had to picture yourself being able to do this and understand, hey, that's for me. I can do this. I want to be part of this. And maybe some way this at the VA, yeah, you've got great health care already, but you know what? Envision yourself stepping in and going to this tremendous place of care. And I got to tell you, 90% of the folks that walk in over there finally walk into a VA, they're like, holy smokes, this is awesome. And they start using it, quite regularly or almost exclusively, like me and a lot of other veterans. But it does start, getting the enrollment done. And once you're in the gate, you're really set for life. You got everything essentially from flu shots to brain surgery. You've got all the health care for the rest of your life. All your needs are going to be met. And it does start off then with your next step then, of course, is to get a primary care doc. You want to have that go-to person. Again, don't have to give anybody up in the community, but you want to have that go-to person, right?
Right.
So, yeah.
Because they're the access point for everything that the VA has to offer, and which you've been talking about, and
you're a medical service corps officer, right?
Yes.
So you knew all about medicine, right?
Not a lot. Well, medical service corps was more the administrative branch, but
but when I came, on the infantry side, and you guys on the medical side is like, I don't want to see you. I don't want to have to go to you people unless somebody makes me. Well, a sergeant grabs me by the ear and says, look, you're bleeding out, you need to go. Like,
right.
I mean, you're the best of the best.
And which can happen with a lot of veterans, a reluctance sometimes to get health care with people in general, but the veteran community sometimes, might hesitate. But one thing I want to point out in my experience as a VSO, if you take that step, enroll in VA healthcare, and make sure you get a VA primary care physician, like you said, that does not replace your outside physicians, and you see that doctor once a year, you can access so many resources through the VA that are not provided by any other healthcare system.
And that's getting used to knowing about, like I said, coming from the infantry side, I didn't know about primary care, especially but that's the gate to go through. Now, so in other words, if I want to use all kinds of things at the VA, I do need to have that primary care doctor. Or maybe I just decide at this point I just want to use the pharmacy, because guess what? Our pharmaceutical prices are capped. You may pay, now depending on your level of disability, or if for your disability, you should pay absolutely $0 for any medications, treatments, whatever. And a matter of fact, I'll just tap that while we're here talking about the costs at the VA.
Yes.
VA care is essentially free or at very little cost. That's what I tell veterans. There are 8 enrollment categories. Doesn't really matter. You're either in or out. And if you're in, you're going to get it either, like I said, completely free, depending on the level of disability, et cetera. Or let's say you don't have any disabilities. And we've got, maybe a majority of our patients don't have any service-connected disability. but they do qualify for care, and that means they're going to get all the same health care at extremely low cost because the only thing you get charged at the VA, there are no premiums, no deductibles. The only thing they pay are office visit copays and perhaps medication copays.
That's fantastic.
Yeah. So that's why I was going, you mentioned pharmacy.
Yes, that's an important one. Yeah.
Like I said, so the pharmacy copays, and this is the cool thing, is that they cap everything. The government has refused to pay any of these crazy high prices. People are paying hundreds and hundreds of dollars for heart medication, diabetic medications.
Yep.
The VA is going to give you those same medications they're going to cap it between $5 to $15, depending on a 30 to 90 day supply. It's all capped at this extremely low price.
That's incredible. That really is. You can't get that anywhere else.
Almost anywhere, yeah.
Nope.
So it's phenomenal pharmaceutical plan. And like you mentioned, of course, primary care is that entry point. You really want to get a primary care doc. But however, once vets are enrolled, the other two great programs in the VA that you don't need a primary care referral for are for optometry and audiology.
Oh, okay.
So those $5,000-$6,000 hearing aids, people are shelling all this money for it. You're going to get that same pair of state-of-the-art hearing aids virtually for free at the VA. And once you're enrolled, all you have to do is call the audiology clinic, say, hey, I want to get going. Sure, we'll set you up.
Yeah.
And within weeks, you've got a brand new pair of hearing aids, free eyeglasses every year. So those are really cool programs.
Yeah, that's fantastic. I mean, that saves thousands of dollars. I want to point out to the audience, you do not have to be service connected for hearing loss or tinnitus to get the free or very low cost hearing aid. You just have to be enrolled in VA healthcare.
So
like our guest was saying, yeah.
And so you mentioned about, well, what do you get at the VA? Well, essentially everything. And then if we don't have it in the inventory, which between West Roxbury, which is, the state of the art, a phenomenal healthcare center, Jamaica Plain VA has 15 floors of, specialty care services, and Brockton Hospital. And then, of course, some folks down in this region, Providence is right there. These are fully staffed, fully equipped hospitals and with emergency rooms, some of them, et cetera. But if we don't have something that I need or you need as a veteran, VA's commitment is they will pay for that in the community in the program called Care in the Community.
Oh.
And so that because the commitment and requirements that they meet every medical need that you might have. The only part of the VA that is what I say is pay to play is the dental realm.
Oh, okay.
Because dental's a big one, right? It's
yes.
So you get all this health care at the VA, everything, like I said, everything you'll ever need. I say kind of an outlier is dental care. We have dental services at the VA, but they're primarily for veterans that are severely disabled, homeless veterans. There are a few other categories. If you got injured and you have a dental injury from service, they take care of that. What VA does have, which is phenomenal, is the VA dental insurance program. So VA will cover you if you qualify for VA healthcare. You also can use the VA dental insurance program, which is basically like Delta Dental or I think MetLife. It's one of those the ones that government employees are able to use. So if you've got nothing else, wow, it is a lifesaver. So there is that, but it is that's the one area you actually have to pay a premium for.
Okay, well that's really good to know because any help in the area of dental care is great, and just the prerequisite is being enrolled in VA healthcare.
Absolutely.
And then you have access to that
insurance. All that other healthcare again.
Oh yeah.
No premiums, no deductibles. Nobody's out to make money off a veteran. It's like, hey, we want to give you care. If you're qualified, you come in here. We're going to bend over backwards to give you everything we can.
That's wonderful. One other area I'd like to talk about is some other durable medical equipment like wheelchairs, walkers, things like that. Yeah. A lot of people call our office. They think we are the federal VA, and we refer them to you guys, but we get a lot of phone calls about people needing equipment. And maybe explain a little bit how that process would work.
Yeah, you're enrolled using, you get your primary care doc and you say, Doc, I need, I'm having trouble walking, or, we're in a 2-story, 3-story house and our bedroom's upstairs and I'm having trouble getting upstairs. It's like, VA is going to pay for all that. But I got a story. My father just turned 100 years old last summer. He's an Army Air Corps World War II veteran, flew in B-29 Super Fortresses and bombing missions over Japan. It's amazing. You know why he's 100 years old though?
What?
Kansas City VA has saved his life on multiple occasions. He started going to the VA about 20, 25 years ago, and they literally changed his life. And so as he lost his eyesight, for example, and did different things, they came in, they provided everything for him. They provide home-based primary care, and they're going to talk about
Oh,
that.
yes, yes. That's a good place to maybe segue into some of the services to help veterans age or recuperate at
Yeah, and
home.
you think of seniors, but any
Yeah.
veteran, if you're challenged to get around, et cetera, the VA through the prosthetics department is going to provide, walkers, wheelchair, all this is free. It's going to be free.
Yeah.
And so, for example, Dad, just to get him out of the house now at 100 years old, we've got several steps. He just got a $10,000 state-of-the-art aluminum ramp that they came in, the VA paid for, didn't pay a dime for.
Wow.
He's able now, family members can take him right out in a chair and take him right out to the car, and off they go. And that's all through the VA, and it was $0. So, I mean,
That's amazing.
where do you get that? Yeah.
And some circumstances for larger home modifications, the veteran may have to be service connected for the condition or 50% or higher.
But a lot of times, there isn't necessarily a requirement. So if they determine if you're primary care, and then from that department, the specialist department will come up and take a look, do a home assessment. That may not even be a requirement at all. It's just if you're getting your care at the VA, you may be able to qualify for that. So.
Oh, that's great to know. Okay.
But you mentioned earlier about you've got all these great things and senior care programs and all of this, and you wonder, well, why aren't all veterans using this and sometimes or using it regularly? You talk about as a medical professional yourself, you're talking about getting people to do what they should do to take care of themselves. I think of it in terms of do you remember preventive maintenance? When I say those words, PMCS. See, we all know this term, right?
Yes.
Yeah, everybody in the military, when you go into service, the first thing you learn, well, number one is that it's not about me. The world doesn't revolve around me anymore. It's about the mission, and taking care of everybody around me. Then it's about me.
Right.
But you quickly learn about preventive maintenance, and that's before I do anything else, before I shower, shave, run off to eat chow. The first thing I do is I take care of the equipment that I've been issued, my weapons or communication, whatever I've got. But first thing I do is do that maintenance checklist post operations, and you do your checklist. Well, it's the same way with healthcare. I realized they got this thing as I started working in the hospital, they got this thing called preventive medicine. So as an infantry guy, I never thought about that before, but I knew about preventive maintenance. But preventive medicine and preventive maintenance, basically the same thing. So the idea is you don't wait to break down. You don't wait till you're inoperable or you're sick as a dog. You go in regularly. Am I right?
Thank you for saying this. This is such an important point.
Yeah, that light bulb went on. It's like, hey, it's the same thing as the Army. They got preventive, maintenance, and so it makes it easier to think about. I need to go see my primary care. I need to do that checkup regularly. And so for some folks that have, you've already got primary care on the outside. Well, hey, if nothing else, go in once a year at least to that VA doctor and do your primary check with that doctor and go through things.
Yeah.
And then as you find that you like it or want to get other things done, take it with both hands. Yeah.
Yeah, absolutely. And it's not only important for a veteran's health, but even if you're doing all the right things and living healthy lifestyle, going into your primary care regularly, getting care, something can always happen. And I want to say to our audience, if you are enrolled in VA healthcare and have a primary care physician and something happens, a fall, something unexpected, you are poised to get help from the VA in dealing with the crisis in a very timely fashion. If you are not enrolled, it's a more difficult
Very
process
difficult, yeah.
when you're in crisis.
Exactly.
So that's
now.
another layer to what David was saying.
Do it now. And there are a number of reasons people, one of those is like, oh, I've already got health care. Yeah, you got health care, but you don't have the great health care you're going to get at the VA. And the other thing is that great military value, we're all taught selfless service. First, again, it's not about me anymore. It's about the mission, about everybody around me.
Yeah.
So many veterans will say, well, I kind of thought about it, but I don't want to take it from somebody else. And that's a great value, right? Because we were trained that way. But when it comes to using the VA, you got to flip that thing around, because by not using VA, you're actually not helping everybody else. Because when you use VA and you walk in, every time you walk in the door and connect with a VA doc, that trips the trigger, gets the funding flowing for all of us. So every time we use VA care, it really strengthens the system. The more we consume it, the stronger it gets. That's one way of looking at it. So I tell vets all the time, don't worry about taking it, because when you do take it, it helps everybody else.
That is very well said, and I'm going to be using that in my office now.
You know, the government works.
So,
we gave you this money, you didn't use it, you must not have needed it. They're going to scoop it back. So as they have, and we have plenty of resources, we're fully funded, even with different changes here under the new presidency, we're still fully funded for all these services, and we're continuing to march with all these programs.
Fantastic. Just to talk about a few specialty programs, we were talking about programs that allow a veteran of any age to be able to stay at home. Wondered if you could talk just a little bit about the difference between the home health program and home-based primary care.
So and that is, you're right, absolutely right. There's a major effort to keep aging veterans in home, realizing if you're comfortable and you like your place, you don't necessarily want to go to an outside care facility. So they have this wonderful program, if you qualify for it, called home-based primary care. So again, I'll use my father as an example. You know, it got to the point at his age, it's very hard to get out of the house. So given his situation, disabilities, they assessed it. They said, that's fine. You qualify for home-based primary care. And they come out to him every couple of weeks. There's a nurse coming out. There's a social worker. There's his primary care doc once in a while. And they're checking on him, doing home visits, doing blood work at home, talking about physical therapy, coming home, exercises. So home-based primary care, if veterans qualify for that, it's phenomenal. Another way to help veterans stay in the home is if you qualify for a home health aide. And again, that's a situation where as they do the assessment, you qualify, then you'll get somebody to come in. The VA pays for all this, and for 2, 3, 4 times a week, several hours at a time, a healthcare worker will come in and help with those activities of daily living, and help the veteran and help around the house there. And it makes a big difference to a lot of people. You're there trying to take care of your aging, mother, father, whoever, your aging veteran, and it's a big burden. So this gives those people a break, the caregivers a break, and you don't have to worry about them, and you can take off and do other things. And that home health worker there is there to take care of things, help them stay in the home. There are programs too, if the veteran can get around. They have adult daycare. In other words, they're just get together social groups that are VA approved, and where you can go out to some local community center or whatever and go and spend that time. If there's a cost associated with that, VA covers those costs to go out and do constructive activities, get you outside the house and do things like that.
So many excellent programs out there. It's incredible.
Yeah, I know.
Yes.
There's a lot. It is a lot. Like I said, it's brain surgery to flu shots, and it's got everything you need. So.
Okay. So, sadly, a lot of our veterans, sometimes similar to the community at large, and sometimes with veteran-specific issues, but suffer from, mental health conditions, PTSD, depression. Yeah. And I know the VA has an array of support for mental health, and if you could talk a little bit more about those programs.
Yeah, I'll tell you, I think there are a lot of us, a lot of veterans who are living with things, and some people have been living with them for decades, going back to Vietnam, or even those that are left from World War II, and not realizing you're carrying a burden you don't need to carry. Thinking, well, I've learned to live with this thing, and I'll just keep, soldiering on or whatever. And there is relief for that. There is a higher quality of living that maybe we don't realize that we could be stepping into. And that comes to these behavioral health or mental health counselors, folks that again are just willing to say, hey, let's take a look at your general state, and are you sleeping well? Are you having a lot of dreams? You having a lot of anxiety about things, and you don't know why? Well, that's all natural, and a lot of times you come out of the military, you actually have post-traumatic growth. That experience makes you stronger, makes you more capable. but it also, everybody has those challenges that they've encountered, and some severely difficult challenges. But the VA has, between the vet centers. So I mentioned, we're the healthcare system, the VBA Veterans Benefits, of course, the Cemetery Administration for commemorative services, and then the vet counseling centers are a powerhouse. And there's 7 of them throughout the Commonwealth here. But the vet counseling centers are a powerhouse for veterans who, in combat scenarios or extremely traumatic stress scenarios in the military as a result of their situations there. But the folks at the vet centers are great about like saying, hey, just come in and sit down. And one of the most powerful things you can do is actually sit down and let somebody at least talk to you about it. And then once you start talking these things out, it's amazing what can happen.
Okay.
The empowerment, the strength, it changes your life, and you become somebody that you should have been or used to be maybe, or become better and stronger and more relaxed, able to take life on.
So that's so important to know those resources are
VA
out there.
will never turn anybody away. There are some veterans, because of what's called bad paper discharge. You've got a other than honorable discharge, et cetera, for whatever reasons you left service in a negative way. But any veteran, regardless of whether you qualify for health care or not, can walk in and get health care at the VA. They will, at least for an initial period, and then they help transition you on to other local.
Oh, that's good to know.
Yeah, so any veteran can walk in the door, even if you're not qualified to use VA care, you can get health.
Oh, okay. So you could go to the emergency room.
Mental health services. Yes. Yeah, just walk into the emergency room at Brockton. There's one at West Roxbury, of course, down in Providence, and then they have what they call urgent care. So there's that there at Jamaica Plain, for example, in Brockton. So.
Okay.
I'm sorry, emergency room at West Roxbury, and then I think in Providence. So.
Oh, very good to know. I don't think I realized that. I thought you had to be enrolled in the system.
Yeah, that's one that any veteran can walk in the door, and I think it's roughly 90 days of treatment. Speaking of emergency rooms, that's another huge thing, right?
Yes, absolutely.
Yeah. If I'm enrolled in VA care, I can walk in almost any emergency room in the country, wherever I happen to be, if something's happening. And as long as I tell them right away, and I have done this, and been traveling somewhere and something, and walked in and said, I use VA healthcare. You know how much I paid? Like $0.
Yes.
They said, oh, use the VA. They collected all through and coordinated with the VA. VA covered every cost.
Yes. So. And you can notify the hospital, and there's also a number to call the VA directly to report that hospital stay.
Exactly.
And that is posted on our Town of Franklin Veteran Services website on the VA Healthcare tab. Very important, because some people don't have full insurance coverage.
And they like to get you. Boy, those are some crazy costs associated with that. And the VA's government says, nope, we're not playing that. We're going to cover the cost, and you gotta come in and we're gonna take care of it. So
another measure saving so much money. A couple other programs to just talk about briefly before we wrap up would be services specific for women veterans and the whole health program.
Yeah, I got to tell you, if you're a post 9/11 veteran, for example, or a female veteran, you're really set at the VA, because they go overboard on extra services for women vets now, and as our number of veterans increased, number of female military members, and we're up 18% or more, we've seen those numbers rise more and more in the VA. So we have a full array of women's health care. There's an entire program dedicated to that. So in each of the major hospitals, there's a whole wing set aside, a whole clinic just for women veterans. So you can go in there, it's just women veterans.
Great.
And again, they provide any of those needs or care, and if we don't have it, we don't have a maternity suite yet at VA Boston, but we pay for it, and I've had any number of little kids coming in and running around at the hospital there, and it's like, yeah, they were, the VA covered, paid for that, all that process. So, but they do cover all those services and procedures. And you mentioned whole health. There are a lot of programs. You walk in the VA, it's a whole array of things, like, we have swimming pools and indoor track, these things where you can go around and do things, and they've got different workout groups, or the MOVE program, where, sometimes you need somebody to, hey, put you on a track, say, you want to shed some of that weight? Hey, we've got a group of veterans, we're gathering here, we'd go through this whole thing and kind of track it, and next thing you know, you're 20, 30 pounds lighter. You didn't go out and pay some crazy online thing to feed to an online company to do whatever. You did right at the VA. So there's a whole array of those activities and programs.
Oh, that's great. You mentioned a program for post 9/11 veterans. Can you tell me more about that?
Sure, yeah. So again, they get, I say, extra quality treatment in the sense that there's the military to VA, now M2 VA, and in other words, transitioning to VA from active service. Roughly anybody post 9/11 falls in that category, but certainly our troops that are coming back now and getting out of service. But there is a whole team dedicated at each facility just to those veterans to help them do a quick assessment of where they're at physically, mentally, emotionally, and then make sure they're locking into the different programs that they have for them at the VA, and troubleshooting things. So like, hey, I tried to call, or I'm trying to get these medications, and I can't figure this out. Walk you right through it. But we do that all the time anyway, or I do that all the time anyway. So, and I always tell veterans, look, if you ever have any questions, I helped get you enrolled, I got you tracking, but just, you've got my number, got my VA cell number, give me a call, and we'll figure it out. And usually we resolve stuff all the time, knock it right out.
Yes. And I have to say, as a VSO, I can fully attest to that. And there's been very difficult situations where you've stepped in, and the VA and has produced incredible results for helping people. Yeah, and really literally coming in and saving the day. So
I tell you, it's this really cool thing, that it's this blessing to be there at this facility and see the work these incredible healthcare professionals do, and mental health professionals, and because they're very mission focused, and they really love being a part of the country, being a part of, it's almost like a patriotic role at the VA, because they understand it's a mission. It's not about getting a government paycheck. It's about serving the country. And people take the oath, same oath that I took when I enlisted, and same one I took as an officer later on. They take that same oath at the VA. So we really, folks at the VA really get it, that it's about the warrior, about the mission, and their service. And so they really do want to give back. And I just feel grateful every day I walk in there. I really feel grateful for that team. And it goes from our just had our new director installed, her husband, military deployed combat Army vet, all the way down, all through the ranks, all the leadership there. Everybody gets it. And I just can't think of any other place that's so great other than being back in the Army, So
it's
really great. It's a really great place to be.
Yeah. And we are so grateful for you, and
right back at you.
The VA Boston team, and all the VAs and the people who work there. Yes, absolutely.
Well, the town VSOs, you are our very best partners in the trenches as we're out there trying to fight this. We're trying to get veterans to access help and this and that. You guys, you all are the best people ever to connect a lot of times, because you're in the towns, you're accessible. Coming into that hospital and this and that might be more of a challenge, or thinking about making that step, but you're right in the town. You're somebody that's local. You make all the difference, and you know everything about doing these disability claims. I know all the stuff that you do, and that's awesome. So.
Oh yes, and any veteran can come, and we can help them apply for VA healthcare. You can go to the VAs and apply in person too, but if you just want to come to our office, and we can help you with that application. And we do focus on Franklin veterans, but if you live in another town, I'll get you either straight to the VA or to your VSO in that town, and we'll make sure that you get the services that you need.
Shannon, that's what I call, it's what we use in the military. Remember, one team, one fight. So working at DC one time, and the Pentagon's folks and the staff there, it's all the different forces, Army, Navy. Everybody's got their thing. Air Force, I'm, Coast Guard. But we realize when it comes to the mission, it's one team, one fight. We all bring something to the table, and combined, we make this very powerful force. And kind of the same way here. Hey, I'm federal, the Department of Veterans Affairs, but there are a lot of things that I can't do with this massive agency. I can't give somebody a place to stay tonight, or help take care of them, or help them with their next house payment. But you can, because the town and the Commonwealth of Massachusetts have these tremendous programs that fill the gap on a lot of things that the big, the federal government can't do. So, but together, it really is one team, one fight. It really does help win this battle for veterans' welfare.
Yeah, I love that.
Yep.
Yes. Anything else you want to share today?
If nothing else, it's like I keep saying, some folks feel like they're comfortable with their health care, this and that. I just say, hey, look, envision yourself at the VA, help other veterans out, help the team out if you care about them at all. Just take that step, get that VA, see if you qualify, and if you use it, or if you qualify for it, come in and use it, just connect. And as you do that, it helps all of us. And if you can use it, take it with both hands, because the more we use it, the stronger it gets. So, but anyway,
Yes.
thank you so much. Appreciate all the work you do here. And
yes, thank you so much as well, and for being here today and all that you do.
Awesome.
I want to say to all our veterans out there, call our office to apply for VA health care or file a claim, 508-613-1315. You have earned this through your service. My name is Shannon. This is Veterans Call, and have a wonderful day.
This program was made possible by your Franklin friends and neighbors, good folks just like you. Thanks for supporting Franklin TV. And thanks for watching.